I love avocado, and it's a good thing. Avocado is great for your heart. I didn't always love it. I had to teach myself. And avocado has its problems too, even its dark side.
Hello, welcome back. Today we're meeting Dr. Ford Brewer to hear him share about 5 superfoods that help prevent cardiovascular diseases. Cardiovascular diseases are quite common and can occur in people of almost all ages. Heart health plays a crucial role for everyone, directly affecting quality of life and longevity. Maintaining a balanced diet and including heart-healthy foods is the key to effectively protecting your cardiovascular health. In this video, we'll dive into the details of 5 foods that can safeguard your heart, helping you build a scientifically sound and suitable nutrition plan. Understanding and learning how to take care of your heart is a vital step in your overall health journey. Without further delay, let's get into the 5 heart-healthy foods recommended by Dr. Ford Brewer. The first food, avocado.
Now, which would you rather eat? A bowl of cereal or an avocado? If you chose avocado, you're right, obviously. This is the first food everybody should eat to avoid a heart attack. Studies show that eating half an avocado twice a week reduces the risk of death by heart attack up to 16% and the risk of arterial plaque buildup by 21%. But why are avocados so special? They're full of nutrients, those right there. A bunch of vitamins and minerals, choline, and many healthy fats. Avocados can lower your triglycerides and increase your HDL. Both things are critical to avoiding heart attacks. But as I mentioned, avocados do have their problems. First, avocados can be pricey, especially with tariffs and some of the fights that go on politically over them. You might have heard of the avocado crisis in 2022 in Texas.
Avocados are rich in heart-healthy fats. A medium avocado weighing about 150 grain contains 14.7 grams of monounsaturated fats and 2.73 grams of polyunsaturated fats. These fats help keep your heart and blood vessels healthy, reducing the risk of high blood pressure and cardiovascular diseases. Avocados are also high in potassium, a mineral most people lack in their daily diets, making them an excellent source to meet your body's potassium needs. According to a study published in the Journal of the American Heart Association, individuals who consume at least 2 servings of avocado per week, equivalent to half an avocado or half a cup, have a 16% lower risk of cardiovascular disease and a 21% lower risk of coronary heart disease compared to those who never or rarely eat avocados. There are countless ways to enjoy avocados in delicious recipes. Start your morning with a creamy avocado smoothie or incorporate avocado into your salad for a fantastic, flavorful dish. The second recommended food is fermented foods.
Well, what's so special about fermented foods? This neglected player that we haven't discussed yet. It's involved in heart attacks and strokes, and it's called the gut biome. You see, inside our intestines, we have about 1 trillion bacteria. So you're not eating for one, you're eating for 1 trillion. That bacteria, those microbes, are more important than you think. They help produce multiple vitamins, nutrients. They keep your body safe from harmful bacteria, and they help with fat metabolism and a thing called neurotransmitters. You remember we mentioned that beautiful garden earlier? That's the gut biome. We really are walking around with a garden inside. You need to take care of it. And anytime you eat processed junk, you're causing a fire, burning all the healthy bacteria and watering the weeds. We call that dysbiosis. Dysbiosis is the growth of unhealthy bacteria and other microorganisms. It's very common in people with prediabetes and diabetes, and it leads to inflammation, arterial plaque buildup, and heart attacks. That's why fermented foods are so good. For preventing heart attacks, you eat fermented foods, you feed the good bacteria, you promote anti-inflammatory effects, and produce healthy micronutrients. You're watering your garden and removing the weeds, and in the process, escaping a heart attack.
There is much debate surrounding fermented foods. However, when consumed properly, fermented foods help balance the body's microorganisms. Not only do they enhance the flavor of meals, but they also improve various health issues. Fermented foods contribute to increased gut-friendly bacteria, boosting gut health and function, while also helping to prevent cardiovascular diseases. Research shows that individuals who consume low-fat fermented dairy, less than 3.5% fat, have a significantly lower risk of cardiovascular disease compared to those who consume high-fat or other types of fermented dairy products. That said, some people are sensitive to fermented foods. They may experience digestive issues such as bloating, gas, or even diarrhea after consuming them. Therefore, it's essential to thoroughly understand the effects of any fermented food before incorporating it into your diet.
I recommend introducing fermented foods slowly, in small portions, once or twice a week. Increasing it slowly avoids bloating or gas.
The third superfood is nuts.
I have to go nuts for this one. Pun intended. Research has shown a decrease in heart attacks. The best options include almonds, hazelnuts, Brazil nuts, walnuts, pistachios, and even peanuts. My favorites, my go-to, are walnuts, almonds, and especially macadamia nuts, and most of all, pecans. I live in southeastern U.S., and pecans are grown here. So I can get and eat a lot of pecans. Macadamias and pecans are very, very good for a low-carb diet as well. So why are nuts in general so good for heart attack prevention? Well, they have plenty of beneficial components, from healthy fats, omega-3 fatty acids, fiber, plant sterols, choline, and even L-arginine. Now, that's an amino acid. It's well known to help produce nitric oxide, and therefore opening blood vessels, reducing blood pressure, and boosting vascular health.
According to a study by Harvard University, peanuts, walnuts, and tree nuts such as pistachios, almonds, hazelnuts, and cashews are linked to a reduced risk of cardiovascular diseases and coronary heart disease. Additionally, consuming peanuts and walnuts has been shown to lower the risk of stroke. Nuts offer a wide range of health benefits, with their rich nutrient profile including diverse vitamins, minerals, and healthy fats. Nuts help lower cholesterol and bad fats in the blood. This reduces the buildup of fatty deposits in the arteries and the formation of plaques. Furthermore, nuts are known to decrease inflammation in patients with heart disease and reduce the risk of blood clots, heart attacks, and even mortality. However, it is essential to consume nuts in moderation and avoid overindulgence. Be mindful of portion sizes and opt for safe and reliable sources to ensure the quality of the nuts you consume, protecting your health effectively.
Now, let's talk about selenium and cyanide. Selenium poisoning might actually be a thing. I don't recommend eating more than 2 Brazil nuts in a day. Cyanide poisoning, maybe not so much, but still at least limit your almonds to 10 to 15 a day. And again, selenium and cyanide will not be an issue for you. I get mostly walnuts from Amazon. I eat a lot of those. I prefer raw walnuts, but dry burnt ones are good too. I just don't get those very often. Avoid any sugar-coated walnuts or other types of processed nuts.
The fourth group of foods is fish.
Just eating fish has been shown to reduce cardiovascular death by about 5%, and that increases for every 5 grams you eat, especially for those fish with high omega-3 fatty acids. Omega-3 fatty acids are the healthiest fats. They include Geek Alert, EPA or eicosapentaenoic acid, DHA, docosahexaenoic acid. Again, I hate that one. These omega-3 fatty acids have been found to be very protective for cardiovascular health.
According to the American Heart Association, individuals with cardiovascular disease should consume approximately 1 gram of EPA and DHA daily. Mackerel, salmon, sardines, herring, and tuna are among the best natural sources of omega-3 fatty acids. However, these types of fish often come with a high price tag, and due to environmental pollution, many fish are now contaminated with heavy metals, posing potential health risks. Dr. Ford recommends exploring plant-based alternatives rich in omega-3s. These options provide a safer and often more affordable way to incorporate omega-3s into your diet. Some plant-based sources include chia seeds, flax seeds, walnuts, hemp seeds, and algae oil. These foods are excellent choices for those looking to boost their omega-3 intake without relying on fish.
You remember that omega-3 acid? It's called alpha-linolenic acid. It also has EPA. Both of these are, again, those omega-3 fatty acids. The seed can be hard to digest. You have to ground it into a powder. I know many people recommend against flaxseed because the conversion of ALA is very low. In fact, ALA is considered to be one of the required fatty acids, and that's because with ALA, your body can make the other two omega-3s, and that is EPA and DHA. Now, regardless, for those that do use flaxseed, I use flaxseed as well. I use it as a powder on my salads. About 4 to 5 tablespoons a day is the goal. And it is a great option.
In addition to fish, seeds such as chia seeds, flax seeds, and olive oil are also rich sources of omega-3 fatty acids. Chia seeds contain plant-based omega-3 fatty acids in the form of alpha-linolenic acid, ALA, making them an excellent dietary option for vegetarians and vegans. Similar to chia seeds, flax seeds are high in ALA, which can help lower bad LDL cholesterol and naturally remove plaque from the arteries. Flax seeds also contain lignans, a plant compound with powerful antioxidant properties that promote heart health. Additionally, olive oil is predominantly composed of monounsaturated fats, along with polyunsaturated fats, including omega-3 and some omega-6 fatty acids. These fats are highly beneficial for cardiovascular health. The final recommended food is eggs.
The result of the Attica study showed that eating an average of 1 to 3 eggs a week can decrease the risk of heart attack and stroke by 45%. Another meta-analysis, again, a study of studies, involving 21 studies showed that eating more than 1 egg a day was associated with less arterial plaque buildup. There's a clear reason for why eggs are healthy. They have no sugar. They're rich in plenty of nutrients, including things like choline, vitamins, and healthy fats.
Egg protein is one of the most complete and high-quality sources of amino acids essential for the body, especially in supporting children's height and weight development. The protein in egg yolk primarily consists of simple and soluble types. In contrast, egg white mainly contains albumin and relatively complete amino acids. In addition, the fat content in eggs is particularly valuable due to the presence of lecithin, a nutrient rarely found in other foods. Lecithin is a vital component of cell structure and brain fluid. Research has shown that lecithin helps prevent cholesterol accumulation, regulates cholesterol levels, and promotes the elimination of cholesterol from the body. The cholesterol content in eggs is relatively high, about 600 nanomoles per 100 grams of eggs. This raises the question, can individuals with coronary artery disease eat eggs? Interestingly, lecithin and cholesterol in eggs share a favorable relationship. Lecithin aids in regulating cholesterol, preventing atherosclerosis, and facilitating the removal of cholesterol from the body.
But did you notice something about all these that they have in common? Yes, these foods are all high in fat and low in sugar. That's the major lesson that changed my life. See, my problem is, and what I discovered when I was creating that plaque was, my body cannot process carbs. That happens to all of us as we age. It happened to me in my mid to late 50s. I found out I had prediabetes. Not eating sugars and carbs is key for me. Right now in America, millions of Americans have been doing the exact opposite. Low fat, high carbs. The base of the food pyramid is grains. But the problem is, over half of American adults have prediabetes. Once you get into your 50s and 60s, that increases to 70 to 85%. Ultra-processed garbage food is high in sugar, low in healthy fats, high in unhealthy fats like trans fats, very low in nutrients, and it leads to the current diabetes and obesity epidemic.
Dr. Ford recommends adopting a low-carbohydrate diet to minimize health issues. A high-carb diet can lead to numerous health problems, particularly insulin resistance. which is a precursor to diabetes, a condition now prevalent across all age groups. If you found this video helpful, don't forget to like and share it with your family and friends. Be sure to subscribe and hit the bell icon to get notified about our latest videos. Thanks for watching.